Sir, we can start it.
Yes, ma'am.
Okay, so start.
Good evening, everyone. Bhartiya Bablu here. On behalf of All India Ayush, I warmly welcome you all to our first webinar. Here is with Shivani Amola Potiyal ma'am from Viswar Ayurved Clinic, Dehradun. Certified expert in Agni and Vidhakarma. A speaker at Vishwa Ayurved Parishad, Uttarakhand 2025. 9 years of professional experience and trained more than 1,000 doctors under her. Welcome you, ma'am. Welcome to All India Ayush here.
Thank you so much, sir. Sir, I am
Please.
audible. Am I visible?
Yes, ma'am.
Thank you so much, sir, for that introduction. And thank you so much for giving me this platform where I can share my views and my knowledge, whatever I have. So today our topic is pain management through Ayurveda. So we will start with that. This is our All India Ayush organization. Okay, so this is All India Ayush organization who is organizing this webinar. So our topic today is pain management through Ayurveda. So as sir have given my introduction. Sir, my screen is visible?
Yes, ma'am.
Yes, ma'am.
It's visible. Okay. So our topic is pain management through Ayurveda. And under this topic, we are going to discuss some Ayurvedic modalities which are untouched, but their results are amazing, but nobody is practicing it right now. So first of all, just we will look what is pain. For a patient, pain is just a symptom. But for today's world, pain is a market of worth million because pain is just not a complaint. Whole system of medicines, investigations, and money revolves around it. Now we will look in Ayurveda. What is pain in Ayurveda? In Ayurveda, a term shul is given to pain, and we also say it ruja. Okay, shul and ruja are the terms used for pain. So, as we know very well that Ayurveda has three doshas, Vata, Pitta, and Kapha. Aggravated Vata dosha, aggravated Pitta dosha, and aggravated Kapha dosha causes disease and other disorders in our body. So, what are their symptoms when Vata aggravated or get vitiated? We get the symptom like pain, dryness, and lightness in our body. Whereas when pitta get aggravated or vitiated, we get symptom of burning sensation, redness, like this. And when cough is aggravated, we get the symptom of cold, heaviness, cyst, tumor, and etc. So it is clearly, we can see it here that it is clear that shul is an indication of Vata dosha imbalance. So let's discuss this Vata dosha. What are the qualities of Vata dosha? Qualities of Vata doshas, as our Shastra says, Tatra ruksho lagu shit khar sukshma chal anilahan. These are the guna of Vata dosha. So aggravated Vata doshas, what happens when Vata dosha aggravated? It increases the rukshta in our body, laguta in body, and kharatva, which is dryness, hoarseness, and coarseness, which causes the symptom of pain. So whenever a patient come to you and he says that he is suffering from any type of pain disorder, so the first point which comes in our mind should be about Vata dosha. That Vata dosha is vitiated, Vata dosha is aggravated, and we have to treat that. And then only we can give a best result to our patient. So when we see the treatment in Ayurveda, so treatment is divided into two parts. It is Shaman Chikitsa and Shodhan Chikitsa. In Shaman Chikitsa, we use medicines, okay, and by using those medicines, those Ayurvedic drugs, we pacify. These are the pacification therapy, and we by using this, we balance the elevated doshas. And in Shodhan Chikitsa, as we all know, it is a purification therapy. And by mean of purification therapy, it says that the aggravated dosha can be taken out of the body with the help of these therapy. So these are two techniques which are used in Ayurveda. One is Shaman Chikitsa and one is Shodhan Chikitsa. So in my experience, when I used to be in my OPD, I have seen so many patients, and then I realized that in pain disorder, by just using Shaman Chikitsa, we can't give results. We have to add Shodhan Chikitsa in that condition. And in other disease like lifestyle disorders, thyroidism, and other disorders, whichever we have of lifestyle disorders, there we can simply go with Shaman Chikitsa, with Yogasan, with Patya, and then we can get result. But in pain disorder, it's not possible to get result by only mean of Shaman Chikitsa. We have to add Shodhan Chikitsa, then only we can satisfy our patient. So let's see this Shodhan Chikitsa. Shodhan Chikitsa refer to an Ayurvedic cleansing therapy that is used to remove excess dosha and harm from the body, and also known as waste elimination or body purification therapies. So in Ayurveda, we study all these therapies, these chikitsa, which are concluded in Panchkarma. So according to Maharshi Shushruta, Panchkarma are Vaman, Virechan, Basti, Nasya, and Raktamokshan. And when we see Maharshi Charak concept, so there Vaman, Virechan, Nasya, and Raktamokshan is not there. Maharshi Charak has divided Basti into two parts, and then he says that there are Panchkarma. But Maharshi Shushruta had added Raktamoksha in his Panchkarma. So we are going to see this now, this Panchkarma. So Vaman and Virechan, as we all know, Vaman, we used to give medicated grit to our patient, and then we go for Snehan, Swedan, and then we give some vomiting medicines, and then we make vomit the patient. And in Virechan, we give again we have a Gritpan, then we have Snehan, Swedan, and then we give medicines, and patient have a loose stool. So these two modalities can't be used for a pain disorders. For example, you have a patient with a cervical complaint, and if you say to the patient that for your cervical pain we are going to give you Vaman and Virechan, then definitely patient will not be convinced or he will leave you. Okay, so Vaman and Virechan is a good detoxification therapy, but we can't use them when patient is having pain. For pain disorder, we can't use these two modalities, so we will move to next. And for these modalities, Vaman and Virechan, we need a full established clinic. You need washroom, you need kitchen, you need sink. Okay, so in a small OPD, we can't do these two processes. Next two Panchkarmas are Nasya and Basti. Nasya again is a very good therapy. Okay, gives good result, but it works Urdhav in Urdhav Jatrugat Roga. What is this Urdhav Jatrugat Roga? Means rog which are above the clavicle bone. Okay, so Nasya give best result in migraine, in headache, in sinusitis, in insomnia condition, but we can't use Nasya for all the pain disorders. So Nasya has its boundary, its limitation. Next is Basti. Again, Basti is a very good therapy. We use it for pain management, but again, Basti is again a long process. We need patient for 11 days or for 15 days or 14 days. We do Yoga Basti, Yapan Basti, Vaitrana Basti. But again, with this Basti modalities, we need a full-fledged clinic and we need a washroom, because after giving a Basti, patient used to go washroom. So Basti can't be used in a small OPD. We need a full-fledged clinic for Basti, and it also gives best result for pain management. And Maharshi Charak have said that Basti is Ardha Chikitsa. So Basti is itself a Ardha Chikitsa we see in day-to-day OPD. We see it in our day-to-day OPD, but again, Basti can't be our first preference because it becomes difficult for us to convince the patient to go through with this type of technique. And here in Dehradun, in North area, nobody is aware about Basti or enema. So it becomes really very difficult for me, for as a Vaidya, to convince patient to take Basti. Female patients, just after hearing this technique, they refuse for it. They say, no, ma'am, we can't go for it. Okay, we feel shy, we are not comfortable. So Basti again have its limitations. We can't go every time. We can't pick Basti for pain management. Then the last but not the least technique is Rakta Mokshana. Rakta Mokshana means bloodletting. Okay, bloodletting means you have seen that blood donation. You have seen that how we do blood donation. So blood donation can be say as a Rakta Mokshana chikitsa, can be counted as a Rakta Mokshana chikitsa. In last 2 days I have patient and he was having fever, and he was having reoccurring fever, and I have tried everything, and I have said him that we will do this Rakta Moksha and all technique. He said, no ma'am, I just want to donate blood. So if you will do Rakta Moksha with me, so I will not be able to give blood donate. I will be not able to donate the blood. So I say him, okay, go for a blood donation. It will also give you result. So he gone for a blood donation, and after 2 days, when he came back, and he says, "Ma'am, after blood donation, I didn't that reoccurring fever has not. I have not faced that reoccurring fever after that." So Rakta Mokshan is a process that we take some amount of blood out of the body. So how it give results? Rakta Mokshana, as we all know, we can take out the blood from all these blood carrying capillaries, arteries, and vein. We use these for to take out the blood out of the body. So as Shushruji says, nahi vatam shira kinchita pittam kevalam tatha shleshma vaha vehante atah sarvah smrita pradushta nam hi doshana murchita nam pradhavatam durvam munam marg gamanam gatam sarvah smrita. It means that these all arteries, these all veins and capillaries which helps in circulation of blood in all over body, they not only carries the blood, but they also carries vat, pitta and kapha dosha. Okay, that aggravated vat, pitta and kapha dosha, and they also carries dushit rakta. So when we want to take out this dushit dosha out of body, we can use this rakta mokshana technique. By this technique, we can take out this vitiated vat, pitta and kapha dosha out of the body. So when we see this Rakta Mokshana in more detail, we see that Rakta Mokshana is divided into 4 parts. It means they have a 4 technique for Rakta Mokshana. First is Shringi, which is it is said as a Shringi Avcharana in Ayurveda, and it is done with the help of horn of a cow. So horn of a cow is used for Rakta Mokshana. This is called Shringi Avcharana. It is practiced in ancient time, but right now no, it is not used too much. Some of places we see that they are using horns, but horns are not easily available. So that's why we are not practicing it in a large number. But centers like Patanjali in Haridwar, Patanjali center is still using this Shringi Avcharan technique for Rakta Mokshana. Then we have Alabhu Rakta Mokshana. Alabhu Rakta Mokshana is done by God. In Hindi, we can say it is done with lauki or ghia. Okay, so gourd is used for Rakta Mokshana. They make it dry, and due to its Ruksha Guna, we used to it's Rakta Mokshana for Vat or Kapha dosha. Then Rakta Mokshana is done by Jaloka Avcharan. So we use leech for Rakta Mokshana, and it is also a very good techniques. It gives good result in skin disorders, and I use it in my practice and get some beautiful results. And then we have Siravedam. So this Siravedam is it is different from all these 3. It is also known as Ardha Chikitsa. Maharshi Shushruta has clearly said that Shiravedam is Ardha Chikitsa, and we see it in our OPD because Shiraved is actually gives 50% result in first sitting. Like patient have came with leg pain, to me in my OPD, and I have told him that we have this technique, and what can I do for you? So he said, tomorrow I am going Delhi, and today is the last day I can take the treatment. I can't go for long treatment. Okay, so in one day, what can you do in only one day sitting? Just do that. So I explained them. So we will go for Sira. So I just took his leg, and whichever vein I have seen, whichever vein we get, I did Rakta Mokshana from that vein, and after Rakta Mokshana, after 15 minutes of Rakta Mokshana, he said that he feel relaxed, he is comfortable right now. So he said, ma'am, I have got relief, and it is almost 50%. So we can see instant result, and I think that's why it is said Ardha Chikitsa. So Siraved gives us best result and instant result. So now we'll see all these techniques individually, right? Individually. So this Shringi Avcharan is done for Vat dosha. If you have aggravated Vat dosha or Vat Pradoshaj Vikara, then we go for Shringi Avcharan. If we have Kaf Pradoshaj Vikara, then we go for Alabu Chikitsa. And if we have Pitta Pradoshaj Vikara, then we go for Jaloka Avcharan. And if we have Tridoshaj Vyadi, then we opt Siraved option. So right now, nobody is practiced Shringi and Alabu, but their combination, which is called cupping therapy, is practiced very much. So we will discuss that, because Shringi and Alabu right now we are not using that. We are using cupping therapy beside that. Instead of that, so this is cupping therapy. Cupping therapy itself gives too many results. So in cupping therapy, we have this cup, and then we have this gun. And by this gun we create a negative pressure in this cup, and then with that we do cupping therapy. So what is cupping therapy? It's a traditional and natural method. It is practiced too much in China. In India it is not practiced so much. It has been practiced in China, and Japanese are some Arabic countries use these techniques too much, and they said that, and they also say that cupping therapy is their traditional medicines. It is part of their traditional medicine. So they have take out so many new techniques of cupping therapy. So we use suction cup for this therapy, and they use this technique, and they don't use any medicine with this, and give result by only using this cupping therapy. And cupping therapy is a safe process, and we when applied correctly, it is harmless and with no adverse side effect. So what is the science behind cupping therapy? We will see that what is the science behind it. So just see how it is done. We put cup at the area where we need to do it. It is basically, cupping therapy is done for a pain management. Okay, if we have a back pain, we have a cervical pain, we have a knee pain, we have a pain on lower limbs. So at that area where there is a pain, we apply that cup. Okay, suppose that this patient is of back pain. He is having a muscular pain in whole back, in lumbar, thoracic, in whole region. So we are doing cupping here. So we place cup over there, then we use this suction gun, and by putting this suction gun, we put up pressure on it. So you can see the skin, this tissue has been appraised there. So there are three type of pressure. If you give one time pressure, then it is called weak pressure. If you give two time pressure, then it is called medium pressure. And when you give pressure three times, then we says it is a strong pressure. So by this is the technique we do cupping therapy. And cupping therapy have different method. There is a stationary dry cupping, flash cupping, then we have moving and gliding cupping, then we have functional cupping, fire cupping, and wet cupping. Now we will see these individual cupping therapy. So in stationary cupping therapy, what happens? We just put this cup, and we give them pressure, the negative pressure by that gun, and we place the cup for 15 minutes. Okay, we place this cup for 15 minutes, and after 15 minutes, we just release the pressure, and we removes the cup. So we will also see how this gives result. So within this 15 minutes, what happened? The skin, as you can see, the skin and tissue has been appraised, uplifted inside the cup. So stressed, the skin, tissues, capillary, artery, vein, whatever it is present there, they all have get stressed. So due to that stress, a blood vascular supply increases over there. Blood vascular supply when increases, it releases endorphins, which helps in relieving the pain. So next cupping therapy is moving and gliding cupping. So this is the way we do moving and gliding cupping. But before doing this moving cupping, we apply oil. We do a little snehan, okay, little is oil massage, and then we go for moving cupping. We give weak pressure. We give weak pressure at our cup, and due to that weak negative pressure, cups we can move that cup around that muscles which is paining. So by this mean we can remove the Mansagata Vayu. Okay, as we all know, Mansagata Vayu causes the pain. So by this we can release the stress and tension inside the muscles. We can release the Vat inside the muscles. So this you can see we have put at a weak pressure. It reduces the muscle tension, improve shoulder mobility. So this is the way of doing moving cupping. We can perform it wherever their patients complain for pain. It can also done in knee, also can be done in calf muscles, in back pain. Then other technique is functional cupping. So functional cupping is done for on diseases where patients say that I'm having pain during movement. Okay, like that this patient has pain on thigh area during walking, and during when he sit down he feels pain over thigh region. So we did functional cupping. So you can see after applying the cup, we ask patient to do function, to do movement on that particular muscles. So you can see after we have put the cup over there, that patient is having it function. So we can do different type of movements. You can raise the leg, you can down your leg, you can move your leg side by side. So this is called functional cupping, and it helps to restore the movement. When patient comes with cervical pain and he says, "Ma'am, I can't move my neck." Okay, at that time we do this cupping therapy. We apply cup on patient's neck, and we say patient to do some movement like this. He moves his leg, he move his neck right and left, up and down, and by doing this, that Mansagat Vayu get releases, that tension, that stress between the muscles get out of the body. Then next we have fire cupping. So we do fire cupping like this. We have a cotton on a needle holder. Then we have a split over there. Then for this we use glass cup. Okay, for this technique we use glass cup. So this sound which you have heard, it is just because of that vacuum. Okay, but fire is doing fire uses the oxygen and air inside the cup, and as air inside the cup is used by fire, a vacuum is created inside the cup, and when we put cup on skin, it get upraised due to negative pressure. So this is the way of doing fire cupping. So we put a cup there for 15 minutes to give best result. And next is wet cupping. So this is which is Rakta Mokshana, and the techniques which we have seen right now, functional cupping, fire cupping, stationary and moving cupping, these are being inaugurated by China. Okay, in our Shastra it is only wet cupping. So we will see wet cupping. So for wet cupping, first of all, we will sanitize that area with cotton with sanitizer, and then we will apply oil. Then we put cup for 1 minute by giving a weak pressure just to increase the blood vascular supply. And after that, we will remove the cup, and with this blade, surgical blade, we put this small incision. Okay, prachan karm. 30-40 scars are made in, and then again we apply cup over there with medium or strong pressure. And due to that, and due to that scarification, blood and due to that negative pressure, blood comes out and collect on that. So this is also a way of rakta moksha. So you can see blood is clotted, and you can see it is thick blood. So we can say alabu chikitsa is done on kapha dosha. So you can see how blood is thick, and it shows that it has kapha dosha. So this is a method of wet cupping. So let's see how cupping therapy gives result. What is the logic behind it? So in cupping therapy, we see that it is our mainstream blood. Okay, this where we can see RBC is the mainstream blood, but in mainstream there is RBC, there are platelets, there are lymphocytes. But beside that, it also have doshas, vat, pitta, kapha dosha, dushit rakta, and when we talk in modern science, it says that disease conditions are mostly characterized by abnormal blood chemistry. Okay, they says it abnormal blood chemistry, and we say it is due to vitiated or aggravated doshas. So blood carries this different causative pathological substances. We can also say it CPS, and they are the agent which causes disease. They are the disease causing substances, and disease related substances are present in the blood and cannot be excreted by physiological mechanism. So these doshas and these impurities, we can't take them out just by aushadhiya or by physiological mechanism. So therefore we use this cupping therapy. And what are these CPS? They are excess serum iron, ferritin in thalassemia, uric acid in gout, inflammatory byproducts in chronic inflammatory conditions. So what happened at a first step, we give a negative pressure inside the suction cup, skin into cup, leading to formation of skin uplifting. Inside skin uplifting, filtration of skin capillaries take place. Due to this upliftment or due to this stress, the capillaries get filtrate. The collective fluid start to accumulate inside the skin, uplifting and approach the most superficial epidermal layer of the skin, but cannot get out due to the presence of skin barrier. Okay, due to this pressure, you can see in this diagram, due to this pressure, these negative particles, toxins, or aggravated vata dosha, pitta dosha get out of the mainstream and get collected just below the skin. So now they are collected here. In dry cupping, what happened? These doshas are collected here. So after that, our lymphatic system come and phagocyte. They engulf all these particles, due to which our body get rid of these toxins, or negative particles. In wet cupping, we see that we do scarification or prachana karma, and due to this, all toxins, negative particles come out of the skin. So this is a technique of rakta mokshana, and by this mean we get results. So by this mean we can take out dushit dosha and dushit rakta out of the body and can get best result. So I will discuss a case that how we get result with cupping therapy. As I have a patient with he was 23 old, and he was a basketball player. His complaint was swelling in fingers in right hand, with numbness, and he was unable to do his daily routine work. He was not able to play his basketball, and he came with a big file of modern diagnosis, and that says that patient is suffering from thoracic outlet syndrome. Okay, so modern medicine system had so many new terminology. So at that moment, I was also not aware that what is thoracic outlet syndrome. Okay, so I get scared that what is this disease. I am also not knowing about it. So I thought, no, I will not see this diagnosis. I will see my patient with Ayurvedic diagnosis. So I forgot about this syndrome, and then then my diagnosis according to Ayurveda, and I find doshas elevation, doshas aggravation, and then I've started the treatment. I told the patient that we can do wet cupping for you, and it will give us a best result. But patient denied. Patient says, no, ma'am, I can't go for wet cupping because my hemoglobin is always on the lower side. So I said, okay, if your hemoglobin is always on lower side, 8 or 10. His hemoglobin was 8 and 10. So I also refused for wet cupping. Then we tried for dry and stationary moving cupping therapy. So we started the treatment with dry cupping. Moving cupping after Snehan Shvedana along the sternocleidomastoid and upper trapezius for 25 minutes. Every day we do this therapy for 25 minutes. And what was the schedule for this therapy? First 3 days we did both time. We did it both time, morning and evening. Then next 3 days we did only one time, and then we did it after the 2 days gap. Then we have given some more sittings with 2 days gap, and after 3 weeks patient got relief and patient was completely treated. So his last word was, "Ma'am, you have saved me. Otherwise, I would have thought for a surgery." So by this cupping therapy, he got the best result. So I have learned on that day. I have learned that I should not go for modern diagnosis, because modern diagnosis each day, every new day they have new diagnosis. They have new terminology. So I will not get into that, and I will do my Ayurveda practice with Ayurveda diagnosis and with Ayurveda therapy. So here we do cupping in knee pain. You can see how cups are applied in knee pain. If patient has a pain during movement, then we also do functional cupping. We say patient to do function, like bending their knees, opening their knees, which give us best result. We also go for wet cupping. In sciatica pain, how we do cupping therapy? We can see this is the sciatica. This is a root of sciatica nerve. Sciatica nerve is the largest nerve of our body, and it's come out from the lumbar area, L2, L3, L4, L5, and sacrum. And from there, it move just behind the thigh, just behind the buttock, and then just behind the thigh. And from there, it goes down to our toes. So this is the root of sciatica nerve. And whenever patient have a compression or slip disc, it sciatica pain radiated to all its root. So for this, we do cupping therapy in this way. Where there is pain, we go for a cupping therapy. So you can see at lumbar area we have put a cup, then we have put a cup at a buttock, then we have put a cup in thigh area behind the thigh. Okay, so this is the way of doing cupping therapy in sciatica patient. Next, you can see cupping in shoulder pain, patient of frozen shoulder. And we also say them to do function. So this is how we apply cup on shoulder pain. So cupping therapy can be done in numbers of diseases such like joint and muscular pain, headache, rheumatic complaint, infertility, sexual disorder, hypertension, bedwetting, common cold and flu, insomnia, stroke, fever, constipation, diarrhea, asthma, respiratory disorder, migraine, headache, sinusitis, and rhinitis. So these are diseases which I used to, in these diseases, I used to prefer cupping therapy, and I do it. So here is a small video. So you can see there are different types of cupping therapy, and according to disease, we can choose which cupping therapy can be used in which disease. So we have seen this Shringi Avcharan and Alabu Chikitsa. So the combination is both of them combination is cupping therapy, which we have seen till now. Now we'll move to Jaloka Avcharan. As we all know, Jaloka in Ayurveda, Jaloka is a creature which lives in water, and in modern way we call it leech. So what is this leech? We will see. You can see leech is a creature which is creepy, and it have a two sucker. One is at his mouth, which is used for feeding, and another sucker is at a tail side, which is used for gripping. And leech have numbers of brain, and it has hundreds of teeth through which he do bloodletting. So we use a leech for treating disorders. So leech therapy is also practiced as a traditional or cultural meal. So there is a Navroz Mela on Kashmir, which held on every March in Kashmir area. You can see this video how they are performing leech therapy, and this Mela is all about leech therapy. In that Mela, what happened in that fair? What happened? People come, small children, young and older people also come there, and leech practitioners come there, and they all put leeches and do rakta mokshana with those leeches. So you have seen right now that small children are also going with this leech therapy. So it is a safe process, and they are using it for forced bite, for arthritic condition, for skin disorder, and it happens in yearly basis in Kashmir. So when we talk about Jaloka Avchan, we should know that there are two types of Jaloka, Service Jaloka and Nirvish Jaloka. So we don't use Service Jaloka because Service Jaloka are poisonous in nature, and when we use them, patient got allergic conditions. So we don't use Service Jaloka. We only use non-poisonous Jaloka, which are Nirvish Jaloka, which are Kapila, Pingla, Shankh Mushkim, Mushika, Pundrik Mukhi, and Savirka. So we use this non-poisonous Jaloka for Rakta Mokshana in patient. Indication for Jaloka Avchan can be seen only in Vagbhata. Vagbhat says that you can use Jaloka Avchan in Gulma, Arsh, Vidhradi, Varn like ulcer, Vatrakt like gout, Vicharchika like eczematous dermatitis, Charmadal, Kitib means psoriasis, Kusht, Vatrakt, Gal Roga, Netra Rog, and Visarp. In all these conditions, we can use Jaloka Avcharan. So let's see how this leech work. So you can see this leech. First, leech will find a spot where he can do this Rakta Mokshana. So he make a grip, and from next side, she at first she secrete a anesthetic fluid. Okay, that anesthetic fluid make that area numb or senseless. So patient don't feel any pain. That area had become numb. There is no sensation. Now leech makes a cut over there. She make an incision over there, small incision, and then next she start sucking the blood. But during sucking the blood, blood can clot. So she also release a herodin. She secret herodin in our blood, so that blood will not clot, and she can easily suck that blood. So herodin is an anticoagulant which does not allow blood to clot. Due to this herodin, leech can easily suck blood. So leech starts sucking blood, and she suck the blood until she get multiply its size. And one specific point with this leech therapy, that leech sucks only dushit rakta. She suck only impure blood, and she increases 10 times with its body weight. So this therapy takes sometime 20 minutes, sometime half hour, and sometime it's also take 1 hour. And after feeding, she leave that area, just leaving an incision over there. So we do pressure bandage over there. Okay, we do pressure bandage to prevent more bleeding, and by pressure bandage we can stop this bleeding. So this is the way of doing leech therapy, and this is a technique by which leech sucks the blood. But leech have put two ingredients in our blood. First is anesthesia, and second is herodine. But not only herodine, it also injects other 100 chemicals in our body, which gives best result, in our disease. So we use leech therapy in hair problems. So you can see we have used leech therapy. So you can put 5 or 10 leeches at a time if you know how to handle them. So there are so many hair problems we use leech therapy, like dandruff also we use hair therapy, graying of hair we use therapy, androgenic alopecia we use leech therapy and get some best result. Then we also use leech therapy in eye disorder. In Shushu Samhita, in Netragat Roga, it is mentioned that you can use Jaloka Avchan at Shankh Pradesha. So for eye disorder, we do it in Shankh Pradesha or in Lalat area. So we can do it on all eye disorders such as cataract, glaucoma, refractive error changes, ptosis, squint, blinking of eyes. Next, we have in thyroid problem also, we can do this leech therapy, laryngitis, pharyngitis, tonsillitis. You can get result in all these diseases by doing leech therapy. So you can see there are 4 or 5 leeches placed at a time. Then we also use leech therapy in abscess like breast abscess, breast carcinoma. So any type of abscess, you can use leech therapy to drain that pus and that impure blood, and it gives some best result. Then we can also use leech therapy in vascular diseases. Vascular diseases like Raynaud disease, varicose vein, Burger disease. These are some diseases which have vascular problem, and there also we use leech therapy. And how leech therapy give results in such diseases, because those 100 chemicals which leech inject in our body, they give positive response to our body, and it helps in revascularization. So when revascularization happens, this disease gets treated. You can see here hands are you can see bluish discoloration here, and after leech therapy within 10 minutes you can see the color has start becoming pink. So so fast revascularizations happen after the leech therapy, because leech actually injects hundreds of chemical in a body. We can also use leech therapy in DVT, which is deep vein thrombosis. So what happened in DVT? There is a thrombus which due to which blood does not blood circulations hampers, and when we do leech therapy, so leech releases herodine in our body, which is an anticoagulant. So that anticoagulant works against that thrombus, okay, and it dissolves that thrombus, and we get some beautiful result. We also use leech therapy in lipoma like condition. You can see here is a lipoma on our forehead. We used leech therapy, and after some sitting you can see the result. So now see where we can use this leech therapy. Modern leech therapy is used in areas such as microsurgery, plastic reconstructive surgery for revascularization. So in today's world, modern science is also using leech therapy. Okay, where they are using this leech therapy in their microsurgery, in their plastic surgery, in their microsurgery for revascularization. As I've already explained that chemicals which leech release in our body, it helps in revascularization. So modern science also use this leech therapy. Then we have cardiovascular disease. I have seen so many results of cardiovascular disease by leech therapy. So in leech, you have seen in cardiovascular patient, modern medical science advises anticoagulant to those patients. So beside this anticoagulant, we can use leeches, and we can use natural anticoagulant, which gives more better result and save the patient life. Then we have dermatology. In every dermatological condition, you can use leech therapy. Then you can also use leech therapy in arch. Either it's bahya arch or either it's internal piles or external piles. You can use jaloka. Then we can use it in vidhradi, also known as abscess. So where there is abscess, you can leech therapy to get the best result. Then we can also use it in ulcer. So we use leech therapy in diabetic ulcer. In diabetic foot also we use this leech therapy and we get result. Like patient, doctor has advised patient for amputation. ठीक है ना? But patient refuses for amputation and he came to us and we started leech therapy and we prevented the patient from going to amputation. Then we also use leech therapy in Vatrak gout condition. Then we also use in eczematous dermatitis, psoriasis. Switra in leukoderma condition also we use leech therapy in deep vein thrombosis, varicose vein. If any one of you is having a varicose vein patient, then just you can blindly you can go for a leech therapy. It has such amazing result. Then we can do in eye disease, in Shirorog, Indralupta, Sandhigat Vata, cellulitis, acne, endometriosis, Raynaud disease, carcinoma. Okay, last month I have had a patient and she was having abscess in her leg. So we did leech therapy for her abscess in her leg. And after 2-3 settings, she said, "Ma'am, does leech therapy also improves the complexions?" I said, "Yes, it improves the complexion." So she said, "Ma'am, my melasma and melasma spots have gone faded by this leech therapy." So it actually works on the skin. So in all dermatological conditions, you can use this leech therapy. In Raynaud disease, endometriosis also we use leech therapy. In carcinoma also we use leech therapy. So here is a small video. You can see how we use leech. Before going for a leech therapy or cupping therapy, we should ensure that patient have its viral marker, hemoglobin investigations. Then only we go for this type of process. So there are some contraindication for this therapy like bleeding disorder, anemia, arterial insufficiency, severe allergy during pregnancy, or if patient is taking anticoagulant or immunosuppressant. If patient is HIV infected or severe anemia, we will not do the cupping therapy or leech therapy to this type of patient. And then some investigations are required like CBC, viral marker, coagulation profiles, blood sugar level, HbA1c, and then only we go for these therapies. So now we have discussed these 3 modalities. Now we are going our last topic, which is Siraved, and it is one of my favorite topic. And I used too much Siraved in my clinic. So Siraved can again be divided into 2 parts. In one part, we used to take out blood in a good amount, okay, like 50 ml, 30 ml, 40 ml. But next is Vidhakarma. In Vidhakarma, we don't take out this much blood. We just prick at some particular point, and these points are described in our Astang Hriday and Shusha Samhita. If you have Astang Hriday, you can go Siravid chapter and you can see all those points like Nasa Gat Roga. Go for Nasa Agre. What is this Nasa Agre point? This is the Nasa Agre point. It means tip of a nose. So these points are actually the door point of our body. So when we prick at this point, we don't need to take a large amount of blood from this point. We just need to prick on this point because here we are doing Rakta Mokshana at capillaries level. So by doing pricking at this point, we opens the door. As this door opens, that aggravated Vata dosha, Pitta dosha just come out of the body and patient gets the relief. So we get instant relief by doing this with the karma technique. So it is a simple, safe, parasurgical process mentioned in Ayurveda for instant pain management. In Shushu Samhita, you can see its reference over in these chapters. And this technique was almost extinct from our education curriculum, from clinical ground. But Vaidya Rava Gopte sir gave rebirth to this technique, and he also added some new points on this technique. He said, do Vidyakarma along with Swarna Shalaka Agnikarma. So now we will see what is Vidyakarma and Swarnashalaka Agnikarma. So whenever we have a pain disorder, Vidyakarma and Agnikarma gives the best result because it gives the instant pain management and it also helps in disease management. So this is Vidyakarma, where we are just pricking by the needle at the points which are mentioned in Samhita, and then we are doing Agnikarma with the help of Swarnashalaka. You can see this is a Swarnashalaka made up of gold. We are handling it with a needle holder, and then we are using candle for Agnikarma. So what happened when we use this Vidyakarma, Agnikarma in our OPD? It's built up confidence in us. It gives instant result, and we can say that first impression is the last impression. So that happens with the Vidyakarma and Agnikarma. Patient trusts the Vaidya, and he trusts that Ayurveda can also give result fast. When we study Agnikarma in Samhita, we see that there are so many ways of doing Agnikarma. There are so many other ways of doing Agnikarma like Lauh Shalaka, Ashtadhatu Shalaka, Panchdhatu Shalaka. But Vaidya Rabagupta sir says that if you want best result, then go for Swarna Shalaka. And if you don't have a Swarna Shalaka, then you can choose other techniques for Agnikarma. So now Rabagupta sir says Swarna Shalaka for Agnikarma. So this is the technique we are doing Swarna Shalaka Agnikarma. So how we do Vidyakarma and Agnikarma? We first perform Vidyakarma. This is a patient of sciatica having a pain, and she is already operated patient of sciatica. She has gone through operation, but after operation also, after 2 years of her operation, she again had that pain, and she now don't want to go for any further operation or any other surgical intervention. So she came to us. We did Vidyakarma. So first we mark some point and we prick over those point. And then we do Agnikarma on those points. You can see Agnikarma. So this is where we are doing Agnikarma. So this is Vidyakarma and this is Agnikarma. This is how we do Vidya and Agnikarma. It is a simple process, doesn't take so much time, doesn't need too much equipment, but results are too fast. Like this patient, when this patient came to me, she was not able to sit. She gave her history just by standing near me. So I took her to the patient bed and I did Vidyakarma and Agnikarma, and after that she said, "Ma'am, I have got 50% relief after this sitting." And after that Vidyakarma and Agnikarma, she was able to sit on a chair. And beside this, she also get lightness in the affected limb. She got relief in constipation. She got relief in her padda, means burning foot complaint. She got relief in backache. She was able to sit and walk, and she also get result in her cracked heels. So when we work on root cause, when we work on root cause, we get these type of result. So this is a patient feedback, but it is on Hindi. You will not be able to understand Hindi. So we'll go further. This is one feedback. My patient has given this feedback. He says that, "Ma'am, this is a 65-year-old patient, and he was having a knee pain, and knee area was almost numb. He don't have any senses over that area. So we did Vidyakarma and Agnikarma, and it gave us instant result." So you can see that how patient is moving his leg, and after Vidyakarma, what result we get. So you can see that instant result by Vidyakarma and Agnikarma. So our students also says that they get result in hypertension cases. And this is one case shared by my student. You can see the patient conditions. It is a Parkinson patient, bedridden patient having feeding tube. So this is a condition of a patient, and after Vidyakarma and Agnikarma, after 20 days of 20 to 22 days Vidyakarma sittings, we got this result. Patient is able to move, walk. Okay, so we get this result in mental disorders also. So Vidyakarma, Agnikarma not only works on pain management, but it also works on disease management. So here we have seen one example of mental disorders, Mansik Roga. Now, this is a patient of knee pain. Age is 85-year-old. This is Mohan sir, who studied online Vidkarma and Agnikarma from me, and you can see how he gave result to this patient.
This patient is 85 years old. This is the second day we are giving Agnikarma. First day itself is 50% of it. And after the treatment, we will see. This is the second day. Yesterday we are given treatment, and this is the second day. He could not walk previously. Yesterday itself, he said he realized it's very good result. I hope today he will be very, very much improved. Let's see. Now he is able to walk very nicely. Very good. And he is saying no pain at all. Vali irka, vali illa. Vali illa. Very good, nice. So I must say thanks to Dr. Naveen and Dr. Shivani madam also. Thank you so much. I request all my friends, please do. You see, he is able to bend his knee also. I request all my friends, those who are studying in Agnikarma and Vidhakarma, please try. You will be getting very good, amazing result. Thank you.
So here you have seen patient was not able to bend his knee, and after Vidhakarma, second day sitting, he is able to bend his knee, and first day patient says that he got 50% relief. So here are some investigations of a thyroid patient. We do Vidhakarma and Agnikarma in thyroid case also, whether it is hyperthyroidism or hypothyroidism. Here is a report of 25 May where TSH is 11.76. After Vidhakarma and Agnikarma on 18th June, TSH is 9.2. So there is a difference of 20 to 25 days, and we get this result. And when I used to go only with medicine, then I will give this result over 6 months. But when we add Vidhakarma in our treatment, it supports very effectively, and you can see with the result within 25 days. There is one more report of a thyroid case. TSH is 36 on 19th March, and after 12 days on 1st April, TSH is 24. So this is this much fast we can get result to our patient by using Vidhakarma and Agnikarma. Then we have so many results of my students. This Dr. Ankurish says, today one patient is suffering from prostate. I was doing only sitting of Shipra and Angushta Mula in both leg. Patient got 20 to 30% relief in 5 minutes. Prostate patient got 20 to 30% relief in 5 minutes, in first 5 minutes. And after 6 hours, patient says that relief was more than 50%. This is Afroz Siddiqui. She says, ma'am, कल और आज हमने menses pain में विद्य किया. So we also do Vidhakarma in menstrual disorder. So for menstrual disorder, she did Vidhakarma and patient got relief after 2 sittings. This is Dr. Rachna, Vidhakarma and Agnikarma in a patient suffering from rhinitis since 20 years. So you can see how chronic disease it is. It has been last there from 20 years. And got relief after 3 sitting of Vidhakarma and Agnikarma. So this speed we can give to our results. So like this, there are so many feedback and there are so many results. We also work on infertility. This is Isha. She got result in her infertility. She has planned for IVF also, but her IVF was also failure. So we gone for Vidhakarma and Agnikarma, and then she conceived. This is also my students' feedback. डॉक्टर शिवानी मैम के द्वारा दिया गया विद्यकर्म से 100% रिकवरी ऑफ पेशेंट इन 7 सिटिंग. The patient was of osteoarthritis, was government employee, and after 7 sitting of Vidhakarma and with some medicines, patient got 100% result in 7 sitting. Then you can see this is Vaidya Shankarji. He says that, ma'am, first sitting 50% improvement in cervical treatment. And this is Dr. Amitji patient. She says 5-year-old sciatica pain. We got result in 15 days. Ma'am ji, namaste. Today 2 patients I did Vidhakarma and Agnikarma. Both are knee pain issue, lower limb Shipromarma as per the class lesson. I got miraculous result, ma'am ji. Thank you so much for great teaching. शिवानी मैम, थैंक यू सो मच। एक पेशेंट को 1 month से आई इचिंग, डिस्चार्ज, redness discharge, 3 sitting of with the patient got 90% result. So you can see we also work on eye disorder like conjunctival hemorrhage. So this is a list where we can get result with Vidhakarma and Agnikarma: sinusitis, rhinitis, migraine, calcaneal spur, thyroid, autism, anxiety, cerebral palsy, epilepsy. These are mental disorders. Okay, Mansik Roga. We also treat them with Vidhakarma and Agnikarma. Then we have tennis elbow, hair fall, jaundice, gout, osteoarthritis, conjunctival hemorrhage, nasal polyp, bronchial asthma. Bronchial asthma is an emergency condition, and we can give immediate result to the patient, and that immediate result can also be shown in oximeter. Like I have a patient with a saturation of 68%. I did Vidhakarma to that patient, and after 5 minutes, when I seen oximeter, the saturation was 84 to 85%. So we can give immediate result to in bronchial asthma condition. Then we can give results in whooping cough, paralysis, GRD, IBS, hyperacidity, reflux esophagitis, infertility, dysmenorrhea, leukorrhea, menopausal syndrome, mouth ulcer, uveitis, tonsillitis. So, Vidhakarma and Agnikarma is used not only for pain management but also for disease management. So there are so many benefits of Vidhakarma and Agnikarma. First of all, it is simple, safe. You can do it in our OPD basis. It hardly takes 15 to 10 minutes, and there are not too much equipments needed for this technique. Only a few equipments are needed for this. So this is how we do Vidhakarma and Agnikarma. So we will see what we have studied today. We have gone through with all these topics. What is pain in Ayurveda? Then we have seen pain management and scope in Ayurveda. Then we have seen how Rakta Mokshan can help in pain management. We have seen 4 types of Rakta Moksha: cupping therapy, leech therapy, Siraved, Vidhakarma, Agnikarma. And then we have seen some results and some feedback of patient. And at last, there should be my experience and journey of Ayurveda. So I'm very happy to share my journey with Ayurveda. So I must tell you that when I was passed, when I that in initial stage when I got out of my college, so I was not very much fascinated with Ayurveda. So I had gone for a allopathic practice, and I have joined a multi-specialist center, and there I have worked for 1.5 years. But one day I realized that they all are giving same medicine for every patient. They were using only one paracetamol. As we all know, the allopathy have only one antipyretic medicine, which is paracetamol. So one day I realized that allopath have only one medicine. But when I was in college, and when one day when I've asked my teacher, sir, how we can do jwara chikitsa, what we can give in fever medicines, Ayurvedic medicines for fever. On that day, he on that day my teacher have explained almost 80 medicines, 80 Ayurvedic medicines for jwara, for fever. Okay, so I realized that Ayurveda is ocean of knowledge. ठीक है ना? और what I'm doing allopathic practice, which is like a glass with half filled of knowledge. Okay, so that day I realized that Ayurveda is something unique, and I should go for Ayurveda practice. And that day I quit that multi-specialist center job, and I started my Ayurveda practice. I started reading books. I started seeing lectures on Ayurveda, and then I started my practice. While doing my practice, I've understood that Ayurveda somehow can't give result in pain management. Then my search for these modalities have been started, and I have gone through with so many doctors, and I've understood this different techniques, how we can use them for pain management. Okay, so this was my journey, and I have blessed with so many gurus who have taught me all those techniques, and which I'm using today in my clinic. And after that, I've decided, so let's teach these techniques to other also. And I have over the years I have trained more than thousands of students with these techniques. So I have certified students. I have done so much work in this field. And just want to share a last feedback, and this is the most beautiful feedback I have got with my student. So he is Dr. Debashish Kundan, MD, PhD, and he is from Bengal. He did my online session, and he says that, ma'am, after my online session, he treated a patient which was 2-year-old epilepsy patient with retarded mental growth. So you can imagine when a 12-year child have epilepsy fits, an epilepsy disease, it means he will go through with those fits, and he was due to which his mental growth has retarded, and he was a bedridden child. He used to lie down on bed whole day. So Vidhakarma and Agnikarma was started, and within three sitting of Vidhakarma, patient reduces fit attack, can speak easily, remarkable changes in orientation, identification, pronunciation, and walking. So this type of result we can give to our patient while if we practice Vidhakarma and Agnikarma. So this feedback is on Bengali.
तो पहले फिट अटैक्स आते थे और हर वक्त बेड में सोई पड़ी रहती थी। तो पहली बार जब मेरे पास आई तो अब लेके 3 सीटिंग हुआ है इनका। अभी ये अपने आप बात करने लगी है, सभी को पहचान पा रही है, बोल सक रही है, मम्मी पापा दीदी सब कुछ बोल पा रही है। पहले एक तरफ देख भी नहीं पाती थी, अभी इशारा करो तो इधर देख रही है, दौड़ रही है, खेल रही है, पहले से बहुत एक्टिव हो चुकी है। और उनका चलना वगैरह बहुत कुछ सही हो गया है, खाना पहले से बहुत अच्छा हो गया है। जो रिमार्केबल चेंजेस आफ्टर 3 सिटिंग ऑफ विद्याकर्मा, ये तो मैं खुद भी नहीं सोच पा रहा हूँ इतना जल्दी कैसे रिस्पांस हो गया। पेशेंट की मम्मी तो बहुत 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 खुश है। थैंक यू मैडम, थैंक यू।
So Ayurveda is all about healing, and it is a word of a healing, and it is a miraculous science when we add these modalities in our treatment portions. Okay, we should, if you are a practitioner, we should incorporate all these modalities in our practice to get the best result. But you should learn how to use this practice. Okay, until and unless you have developed this skill, you can't get the best result. So first of all, just learn these techniques, practice them, karma abhyasa, yoga abhyasa, and then do it on a patient, and then you will get the best result. So all thanks to All India Ayush Foundation for giving me this platform. For any type of queries, you can call on this contacts number. So if you want to learn all these techniques, so first of all, I will suggest you to go to your nearby doctors who are practicing these techniques. Okay, if you find those doctor, just learn there, just do your practice, and then you can do on patient, and you will get the best result. But if you don't find any guru, you don't find any source to learn these techniques, then you can contact on these number, and you can tell us that you want to learn this technique. Then we will plan a course for all of you where you can learn this Vidhakarma, Agnikarma, leech therapy, and cupping therapy. Okay, all thanks to all of you for participation. Is there any question? If anyone want to ask any question, we can take that question. You can raise your hand, or you can ask your question on chat box also. Okay, I'm sure there is no question right now. So whoever wants to learn this technique, how to improve eyesight. Okay, for eyesight improvement, you can go for a Vidhakarma. Vidhakarma points for eye disorders are, we go for a Shivani point, we go for a Lalat point, and we go for a Pang point, and then we go for a Upnastika. We take these 4 points with the karma. You can also go for a leech therapy. You can also leech therapy gives the best result in eyesight improvement. I have tried in so many kids, and their specs, their glasses have been removed by leech therapy. You can also go for a netra tarpana like techniques. Is there any restriction on Vidyakarma, when to do and when not? Anything special we need to care of? Exactly. There are so many things to learn. Vidyakarma, I have so many restrictions. Like you can't do it in pregnancy. You should not do Vidyakarma on Marma Plesa. These restrictions are there if patient is having low hemoglobin, if patient is having taking some sort of medicines, then we don't do Vidyakarma. Yes, there are some restrictions, there are some do's and don't, but for that you need uh, to learn it very, very clearly. Okay. Pain in scapular region, we go for Vidyakarma in trapezius muscles. We take points for trapezius muscles. We take points for joint. We take point forefinger above the elbow joint, forefinger below the elbow joint. We take Shipra point and Agnikarma on those points, and gives the best result in scapular pain. Can we use Rakta Moksha and Vidyakarma in any kind of inflammation? Yes, you can go for Rakta Moksha and Vidyakarma. We don't do Agnikarma on inflammation, but we do Vidyakarma and Rakta Moksha in inflammation. Rakta Moksha and inflammations give best result because inflammatory agents come out of the body, and it gives best result in inflammatory conditions. Diabetes में कर सकते हैं. Exactly, we can do all these techniques in diabetes, but we make sure that it should be a controlled diabetes. Yes, exactly. If you all will say, if you all will, we can plan future courses for this. Okay, we can plan it, but there should be a good number of students. Then only we will plan it. On that, for that, what we can do first, we'll take online class, and then we will go for an offline session. Okay, online for online we can take 5, 6 or 7 days classes. Every day we can take 1 hour for that class, and then 7-day course. We can plan for a 7-day course and 1 hour class, and then we can go for an offline session also. If there is a good number of a student, I can come to a place like Odisha. I think this all we have audience from Odisha. We can come. I can come Odisha, and we will plan a session over there, and we will see live demonstration over there. Because till now, what we are doing, we are taking online session, and then we plan for offline session. But for that, I really need a number. How many students are going to enroll for that? So whoever want to study these techniques can contact to Bhartiya Bablu sir, and then we will plan. October, I am busy. We can plan it on November.